During your lens exchange surgery, you were implanted with a monofocal lens. Many individuals aren't even aware that a lens is put into their eye during cataract surgery. They think it's just a scraping procedure and find out afterwards. There are multifocal lenses that can correct presbyopia. Some people feel very regretful when they learn about this later. Among many doctors, there are still those who insist solely on using monofocal lenses or do not utilize other lens options, and this is why some patients, even after undergoing surgery and achieving reasonably good vision, express significant dissatisfaction with the necessity of constantly wearing glasses. So, the surgery on the right eye was successfully completed, and the prescription is correct, and the vision is quite good. But not being able to see things up close is really quite inconvenient, and since the other eye is in a nearsighted state, the difference in vision between the two eyes is just too much, causing a lot of discomfort and dizziness. The surgery itself was actually quite successful. The left eye currently has nuclear cataracts, and as a result, this individual expressed a strong desire for a multifocal lens, so we utilized a Phenotix lens for that eye. We also proceeded to replace the lens in the right eye and precisely adjusted the refractive power for both eyes. Now, the closer the value is to 0, the better aligned it is with the target. Near vision is much better, and distance vision is good too. However, distance vision with this is not quite as good as it is with a monofocal lens. That's because a monofocal lens uses 100% of the available light for seeing things far away. Multifocal lenses, depending on the brand or type, adjust the amount of light for near, intermediate, and distance vision. They function by distributing the incoming light to different focal points. For example, 50% for distance, 25% for intermediate, 25% for near, or 40% for distance, 20% for intermediate, and 40% for near. Ultimately, you lose about 10% of the total light. So, since about 80 to 90% of the light is divided up, night vision can be reduced because there's less light available at night. When it comes to distance vision alone, monofocal lenses are obviously better, assuming there's no astigmatism, or even with monofocal lenses that correct astigmatism. Compared to that, distance vision might be a little less sharp, but multifocal lenses have greatly improved recently, and with lenses like the Phenotix, the efficiency of light usage has increased as well. Currently, many lenses are available with light utilization rates exceeding 90%, and the sharp edges of the diffractive rings have been smoothly processed, substantially reducing light scattering and diffuse reflection, thus significantly decreasing glare. So, multifocal lenses these days provide very good distance vision, often achieving 20/20 or even better, and there is substantially less glare than one might anticipate. Many people also report no discomfort when driving at night. When performing secondary surgery, it's especially important to check the number of corneal endothelial cells, which is typically over 2,000 in a healthy adult. Also, some cells can decrease in number when you have surgery. As you get older, the number of these cells tends to decrease slowly, but if the count drops below 1,000, it's really best to avoid any secondary eye operations unless it's truly essential. This patient had good endothelial cells, so we did the surgery well and confirmed the cells did not decrease after the second surgery. So, in conclusion, distance vision became slightly blurry, but the visual acuity is 1.0. Even if visual acuity is 1.0, clarity may be slightly reduced, but especially those with severe cataracts often say they see far very well. So ultimately, this subjective experience can vary greatly from person to person, depending on how severe their cataracts were or how well they could see at different distances before having the surgery. But overall, they often achieve quite satisfying distance vision, and if they couldn't see well up close before, with the J1 lens, their near vision is 1.0. Seeing 1.0 up close made them very satisfied. They can read books with their naked eyes and comfortably use their computers or phones, so they can essentially live quite freely without needing to wear glasses at all. Therefore, before undergoing cataract surgery, it's crucial to have a thorough discussion with your ophthalmologist about your specific needs and expectations. After fully understanding all aspects and having a good idea of the likely outcome following the procedure, you can then proceed with the surgery. This careful planning helps to significantly reduce potential discomfort and other issues that might arise after the operation. Then, you can enjoy a happy and fully satisfying life. So, I've shown you many different cases where the intraocular lens was replaced. At our hospital, we often perform secondary surgeries, so we have experience in replacing various types of intraocular lenses. Generally, this procedure involves the removal of the implanted intraocular lens and its replacement with a different type of lens. This is done to address issues like lens dislocation, type of lens, refractive errors, lens opacity, and other complications. So usually, it's the first type of case that happens most often. In a typical cataract surgery procedure, the goal is to preserve the capsule of your original eye lens, only removing the protein material inside it. If the surgical procedure is successful and the lens capsule is well preserved, then utilizing that capsule as much as possible is the best approach to optimize both the refractive power and various optical phenomena. So it's generally considered best practice to carefully preserve that specific part during the surgical procedure. However, on occasion, the initial surgery proves to be quite challenging, resulting in damage to either the delicate capsular bag or the supporting ciliary zonual ligaments, which then unfortunately makes it impossible to securely place a lens in that particular location. In situations like that, we perform scleral fixation surgery. This involves removing the lens capsule and directly suturing the lens to the white part of the eye, or directly fixing the haptics, which are the legs of the artificial lens. Consequently, the scope of the surgical procedure becomes somewhat larger. In such instances, we frequently also need to do retinal surgery or a vitrectomy, which makes for a more challenging procedure. So, while it's not always possible to replace the artificial lens in every case, it is possible in most cases. The specific method employed may differ based on the eye's condition. It's beneficial to have this information. Based on your specific eye condition, it's important to discuss and carefully decide on the best method.
Cortex vacuum 450.
Yes, that went very well. If you trust us and visit, we will do our best to provide excellent care. Thank you.